few moments where it'll say live on Facebook. We are live.
Nice.
So I'm going to take a couple seconds to share. And if you guys want to share, you're welcome to do the same.
Okay, now I see it. Okay.
Where it'll say live on Facebook. We are live.
Nice.
I'm sharing.
So I'm going to take a couple seconds to go ahead and mute the mute it on your pages. I just want to share your so we don't hear the feedback.
Okay, now I see it. Okay.
Where it'll say live on Facebook. We are live.
Nice.
I'm sharing.
So I'm going to take a couple seconds to go ahead and mute the mute it on. I'm going to take a couple seconds to go ahead and mute the mute it on your pages. Hi.
Nice.
I'm sharing.
So I'm going to take a couple seconds to go ahead and mute the mute it on. I'm going to take a couple seconds to go ahead and mute the mute it on your pages. All right. All right, welcome everybody. I am Dr. Turshá Hamilton and I am a naturopathic physician. And I wanted to bring together some of my colleagues to give you guys information about naturopathic medicine. Recently, I'd gotten several questions basically asking some basic information about what naturopathic medicine is. And so what better thing to do than to answer that question or those questions for everyone. So I've gathered some colleagues. I have a student and we have some naturopathic physicians that have been practicing for a number of years. So we get a variety of responses to these questions. And I encourage you all to, one, share this video with your networks so that you all can know a little basic information about what naturopathic medicine is, who naturopathic doctors are, and you can remember to post questions. Ask questions. We are more than happy to answer questions. That's why we're here. So what I would like everyone to do, all of the doctors and the student doctor, to share who they are, who you are, and where you are. So let's start with Dr. Yates.
Hey everyone, Dr. Beverly Yates, licensed doctor in naturopathic medicine for over 26 years, practicing just north of San Francisco and Oakland, California, and Corte Madera in beautiful Marin County. My specialties are diabetes and heart disease, and hypertension is so common in both problems for a lot of different reasons. And I'm grateful to Dr. Turshá for taking the lead and creating an upcoming hypertension summit. Blood pressure is an issue for so many people for so many reasons, and the events of the last few weeks have made it crystal clear why some of us are far more likely than others to have the problem.
Absolutely. Dr. Mai.
Hello, I'm Dr. Heath. I'm zooming in from Chicago, Illinois today. I'm a naturopathic doctor. I'm also a labor and delivery doula and a childbirth educator. I work in family medicine, but because of my background in doula work and birth advocacy, I do see a lot of women's health and pediatric health. Thanks for having me, and thanks for, I'm excited to chat with you all today.
Absolutely. Now, Dr. Safiya.
Hello, everyone. My name is Dr. Sofia Mccarter. I'm a naturopathic doctor, acupuncturist, educator, and consultant, and I am currently practicing in Silver Spring, Maryland. I have been in practice overall for, it's my 10th year.
Congratulations.
This year is my 10th year. Practicing acupuncture since 2015, naturopathic medicine since 2010. My clinical focus is reproductive health and pediatrics.
All right. And student Dr. Williams.
Hello, my name is Kailey Williams. I am a fourth year naturopathic medical student at the Southwest College of Naturopathic Medicine. Currently very much interested in community medicine. That's been my focus since the day I started. So I'm really excited to be here with you guys. Thank you.
Excellent. So the first question is, what is naturopathic medicine? Can you guys give in your own words, or like, what is your spiel about what naturopathic medicine is?
I often say that naturopathic medicine is a system of integrative medicine that uses the body's own healing mechanisms to help guide you back to balance. That's my elevator, your 30-second speech that hopefully, that will pique interest in someone, or it will resonate with someone to realize that, okay, I need to know more about this and see how this can help benefit my goals for my life and, for my health.
I think I said something very similar, short and sweet about it, supporting the body's ability to heal itself. Yeah, and then answer more, give more information if more questions are asked. Because generally, if I just say I'm a naturopathic doctor, it's like, you're what? So I'm like, okay, so I practice integrative medicine or natural medicine or holistic medicine. So trying to find the terms that folks are familiar with, and then explain further from there. I also tend to include, if I'm going a little bit further into detail, the use of natural therapies. So using a variety of natural therapies to treat a variety of conditions.
Excellent, thank you.
I tell people that naturopathic medicine is a combination of the science of medicine and the art of healing to promote wellness and help people identify root issues, root causes that may have gotten them into trouble, and then help them to restore healing where possible. And that in this kind of medicine, they are at the center. It's not so much about any procedure or therapy I'm going to do to them, but rather I'll walk on the journey with them. And along the way, we might use supplements or herbs, vitamins, minerals, nutrients, homeopathics, intravenous, nutrient therapy, etc. But the bottom line is this: many of the therapies are rooted in lifestyle, and whatever we can do to correct and adjust is really what's going to serve them. So I'm helping to teach them how they can live well with whatever their health circumstances may be, including environmental factors that have influenced the genetics that they were handed. You don't get a choice about your genes. You might not get a choice about your environment, but if we can do something about that, that's healing, then I'm going to help them figure that out and get there.
Excellent, thank you.
I always explain naturopathic medicine as us being specialists at peeling back the layers and really finding that root cause. Like Dr. Yates just said, it's plenty of factors that go into different conditions. And so we are specialists at just targeting all these different areas to get you at your optimal health.
My explanation of naturopathic medicine is somewhere in between. Basically, we use holistic natural methods primarily to help the body heal itself. We are trained in conventional medicine, so many of us can and do write prescriptions where it's necessary. I know for me, when I was doing that, I didn't do it very often, because if I wrote it, it was because a person actually needed it, but it was never our end goal. The goal is to get the body to heal itself and to do what it needed to do in order for you to thrive and have better health. So another question that I got recently was, what can I expect when I see a naturopathic doctor? Or how is visiting a naturopathic doctor different from visiting a conventional doctor? Let's start with student Dr. Williams.
Definitely expect time. We spend time with you, a lot more time than I know that most people are probably used to going to a doctor's office. We ask a lot of questions, and we get in there deep and personal. Expect a lot of different things, asking about your lifestyle, There are many, many things that contribute, again, like I said, contribute to your health or lack thereof. And we ask a lot of questions about that, including stress in your sleep and things like that. So expect to put in a lot of time in your first doctor's appointment, for sure.
All right. Anyone want to add to that?
I tend to tell folks that it's not too dissimilar from what they experience going to a conventional general practice, like their primary care physician. That the questions that I'm going to ask are going to be the same kinds of questions. The physical exams that I do are going to be the same kinds of physical exams that you would get when you would go to your MD GP. But where the fork is my approach to treatment. So the time definitely, as future Dr. Williams mentioned, that is definitely something, because they're expecting to come in for 15 minutes max. Yeah. It's like, actually, no, you're going to be here for an hour, maybe a little bit longer. And the departure is going to come when we start talking about approaches to treatment. So my approach to treating is going to be different, but everything else that you experience while you're sitting there is going to be fairly similar. And I that is helpful to people that think that this is somewhere far outside the realm of medicine. It's like, no, it's medicine, but the approach is going to be different. The therapies that I'm going to use are going to be different. If it's safe, because I'll get folks that will say, well, I'm coming to you because I don't want to be on my medications. And my response to that is, well, we have to see where you're at. So we have to see if that's going to be safe for you. And appropriate for you. So let's talk about that. Let's talk about that. So it's the approach that I remind people of or inform people of that's going to be different than what they're accustomed to.
I tell people to expect highly individualized care. It is not, treating a condition. It's not treating symptoms. It's treating the individual. And to also expect a lot of, not to abdicate any sort of responsibility to, your practitioner, that really your health is in your own hands, and really even planting that seed that you are capable of managing your health. Of course, seeing your physician, your healthcare team as part of a toolkit in a certain way to help you achieve those goals. But that highly individualized care, that, that questioning of, what is your chief concern, but then what are some other things that are going over, because we might be able to find some overlap so that we can really give you a treatment plan that's tailored. And so that's what I would, tell people to expect, that they may have, but may not have experience with a healthcare provider in the past.
Mm-hmm.
Yeah, I tell people to expect that we might do lab work that is different than what they're used to seeing. So we can certainly order the standard things like a CBC, a complete blood count, and a chem screen, and cholesterol panels and things like that, A1C, et cetera. But in addition, that we are well aware of and well educated about physiologic-based lab testing, as well as cutting-edge things that really aren't common yet and should be, whether it's food sensitivity testing, genomic testing, whatever it might be, to really help uncover the key issues that are interfering. Because without that, we wind up just putting on symptomatic Band-Aids. And while relief is awesome, it's great to help people feel better, we also want to see if we can't unwind the issue altogether.
Mm-hmm. Yes. So we talked about the systematic, the approach being different from what we as naturopathic doctors do versus what a conventional doctor will do in their office. That to me sounds like it gets into the naturopathic principles. So doctors, could each of you give me like a principle and what that principle means to you?
Treat the whole person. That's a big one for me. And one that I often I think that's the one that I talk about the most, is that I am interested, and a part of my bio will say that I form a relationship with my patients, and I'm interested particularly in the psychosocial, psycho-emotional contributors to health and wellness and even illness. And so in treating the whole person, I'm interested in knowing all of these things that are like, I'm interested in knowing about like your life and what's going on in your life. Not only is that going to help me to explain to you why you may be experiencing some of the things that you are, but it also is going to give me the clarity on where we're going to be able to start and how fast we're going to be able to go. Because your life may be at a point where you're not able to do some of the things that I'm asking you to do. And the goal is to make sustainable changes, and I may need to wait until you get to a point in your life where it's a little less hectic, where maybe you've already moved and you're settled, or whatever the case may be, that's going to allow you to make the sustainable changes that is going to impact your health in the way that's desirable. And some of that is going to be looking at things that may seem outside of that may not seem relevant. Do you have supportive relationships? Do you like the work that you do? Are you doing the work that you want to do? That's important. So the treat the whole person, and asking lots of questions about other things in their life is my number one principle.
For me, doctor as teacher is mine. I can't tell you how many times I've seen patients, I've talked to family members, and you ask about their doctor appointment and they can't even tell you anything about their condition or what's happening, what's going on. And I just I get so frustrated sometimes. And so that's the number one thing when I am seeing patients, that I want to make sure that they understand what's going on in their bodies and that they can explain it. And that way they can become an advocate for themselves and be able to tell other doctors, what's going on with them. So that's my number one, doctor as teacher.
Yeah, for me, it's same, doctor as teacher. I'm always amazed how many years and decades people will go sometimes to the same doctor and they don't have a clue what's happened. Nothing's been clearly explained to them. And sometimes people have asked great questions. They've simply not been answered, which I think is disrespectful, including when it would have been appropriate for the doctors they've been seeing, other healthcare practitioners, to just say, I don't know. Humble pie is good. It's honest. I've never had anybody run out the office because I said, I don't know. If anything, people have told me they just had a lot more respect for me, and they've stayed often for decades because they just feel like it's a real person talking to them and trying to help them understand. Sometimes they're at the complex intersection of multiple chronic illnesses. I've often seen people with really, really difficult cases. And so I have felt duty bound to be as clear as I can in my descriptions of things. And there have been times when I've sent people back to their other doctors with a script, literally written out, what to say, what to make sure they actually get an answer that they feel satisfied about. And it's not to shame anybody or put them on the spot. It's just my point of view is, look, you're paying people for services and for results, right? For treatments, whatever. So you need to be in charge of what's happening to you, your body, your soul, your psyche, because you're the one that lives with it. I'm not the one up 2-3 o'clock in the morning miserable. It's you. Yeah. Nor is it any of the other people who are, like sometimes people are like, oh, I don't want to bother. I'm like, well, then you're taking it on yourself, right? Like sometimes I feel like we also need to be a champion, an advocate for people to feel like it's okay to push back and to make sure that their needs are met. And if there's any mental illness or other compromise where they might really have a difficulty doing that, then I try to figure out with them who can go with them to their doctor's appointments. I've had people record mine, whatever mix works, but very much about docere, the Latin word for doctor as teacher. Absolutely.
Yeah, I thought we have so many beautiful tenets and they're so eloquently stated. And I thought, first do no harm. I thought about the vis medicatrix naturae, the healing power of nature. But my heart really lies as with some of my colleagues here with doctor as teacher as well. I think Dr. Yates just mentioned so many amazing points of that tenet. But I'll say, just speaking very specifically to the section of the population here in Chicago that I so often work with, are young families of color. And a lot of them do not get that they don't get heard even by their medical professionals. They walk away maybe with, an info sheet, but when it is 2 or 3 o'clock in the morning and they don't know if what they're experiencing is an emergency or not, then, you know, especially as a doula who's on call 24/7, you know, I get a lot of that sort of discussion and talk. And I also send the people that I work with, you know, to their allopathic or their conventional medical doctors, and say, you know, every time you have to be asking questions, you have to be asking, what are the red flags? What are the yellow flags of this? And of course, we do a lot of that education as well, but just helping them to find that empowerment, so that when they're in those situations, they are really, they're getting better to be able to manage their own health, manage the health of their children and those in their community. So that, and then informed consent goes with that. You know, people knowing what their medical options are and being able to weigh the pros and cons. You know, knowing that you don't have to accept every treatment or recommendation that's given to you. You should ask questions. What are other things that I could do? So anyway, that really touches my heart, because each and every time I deal with the population that I so often work with, those are the big concerns.
I think one of my favorite tenets, I mean, I love docere. Like at this point, I think doctor as teacher is like my main mission, is to educate, which is why I do a lot of the things that I do, because I'm in that education space. And treat the whole person is beautiful. Like it took a while for me to understand what that meant, because I wasn't accustomed to it in myself. Like I had to learn what that means. I think the one that I want to touch on is treat the cause, tole causum. One of the reasons why we ask so many of the questions that we ask when you come to visit a naturopathic doctor, either for the first time or for the 100th time, is because we're trying to get to the root of what is happening. And as student Dr. Williams mentioned, that is why you're going to get some of those really odd questions, and why we're going to spend so much time in the office with you, is because we're trying to understand where you are right now, where you want to be, and what got you there. And once we gather that information, we can figure out a plan to help get you to where you want to be based on all the information that we've given you. And so we have to get all that information, and it will take peeling away the layers sometimes. And so sometimes you'll only be able to do so much in the first visit, or in the first few months, or in the first couple years. But then once that thing resolves, then we can go a little bit deeper and get deeper healing. And then we can go a little bit deeper. And so treat the cause is a big one for me. Do you guys have anything to come back on?
I wanted to say something briefly from what you said. It actually made me think of one of your earlier questions about what people should expect when they come to see a naturopathic doctor. They shouldn't expect a magic bullet. And that what you were just saying really goes to that. And I think so often some people are like, okay, well, I'll try this, you know, to see. But really what we do is our lifestyle changes. And, you know, there's our hierarchy of care. I think it's by Jared Zed. I don't want to get it wrong, but hierarchy of care is, I've always loved this piece of artwork, because it talks about how at the base level, we're doing lifestyle changes. That's really what naturopathic medicine is. That's us right there. And as you go up, needing different, you know, therapies and surgeries and things like that, because we know in integrative medicine, those things are necessary. We do need the other end of the spectrum, you know, but yeah, not to expect a magic bullet. It's going to be a partnership. I'm going to meet you, you're going to meet me, and we're going to work together every step of the way. Like I believe Dr. Yates said, for sure.
Dr. May, I totally hear you. One of the things that I love about your comments here about this is that, you know what, here in the US, and I don't know if it's true everywhere in the world, but certainly in the US, there's so much marketing and promotion around the quick fix. Take this pill, take this potion, and you will be healed, quote unquote, loosely healed, in 3 to 4 hours, maybe 24 hours, right? People have such unrealistic expectations when it's often taken years, and sadly sometimes decades, for this illness to take hold. We can't pull out the roots in a short period of time. And so I always ask my patients, give me a month for every year you've had this misery. And I find that's a very safe balance. And I always tell them, look, not only am I humble about this, I cannot make you ethically a claim that I'm going to be successful, but I'm going to do everything I can to help you be successful. Now I can make you that promise. Hopefully your body is able to respond based on the details of what their health problem is. But with that in mind, it's just really important to let people know that one of the reasons why this kind of medicine doesn't have the tens of millions, hundreds of millions, billions of dollars of marketing money behind it is because it takes time. And as you so beautifully said, it's about lifestyle and how people are living and how life is coming at them and trying to find a way to raise them up so that they can actually heal. And in that, we don't know what that timeline will be. And that's just an honest statement. I think that most patients that I've had have almost breathed a sigh of relief because they've realized that whatever's going on with them, if they're honest about it, if they really think about it, it didn't happen overnight. This isn't acute care in a car accident where someone's bleeding and now needs to be stitched. That did happen overnight and does get an immediate fix. You know, you go get stitches, right?
Right.
This isn't that. And so if you've got a chronic illness, you know, like heart disease, asthma, arthritis, it's going to take some time for this to be better. The good news is that all of the tools that we have at our disposal help people to feel better. None of them make them worse. Yeah. Unlike conventional medicine, which sometimes in the pursuit of trying to help people also harms people. Yeah. So the whole idea of not harming people, you know, is also a core tenet with what we do.
Absolutely. So one question that was asked of me is, do we set health goals together and work toward achieving them together, as in the patient and the doctor?
That's actually something that I was when you were asking if there's anything to circle back around to, but it was that what
you're frozen.
Uh-oh. Am I not?
All right, you're good now. Go for it.
Yeah?
Yep, go for it.
Okay. Sorry. So that is something that came up for me, and everything that folks are saying is in that question, yes, absolutely. You are an active participant. We are partners in this together. I'm seeing you for the first time for an hour or so, and I will continue to see you for about an hour or so. As Dr. Yates mentioned, you're living with this 24 hours a day. You've been living with this for however many years. There is some information that you're going to have to give me about this. I know what I know from a clinical standpoint because I've learned it, but you never get someone coming in that follows the textbook definition of any disease process that we've learned. So what is happening with you is unique to you. There are a unique set of circumstances that are impacting what's happening in your life, what you're experiencing, that's making it better, that's making it worse. And you have to let me know that. So you have to participate. That's one of the things that I actually love about naturopathic medicine is that there's a level of responsibility. There's a level of power that it gives to the patients. And there's a level of responsibility. You're not just gonna lay back and take a pill. You're not gonna just lay back and take an herb. That's just not how this works. And I love that because, you know, I think that it's empowering for people to know that they have a measure of control over what's happening with them health-wise. So like Dr. Yates mentioned earlier, you know, you may not be able to control your genetics. You may not be able to control your environment, but what you are able to control, we're going to figure out a way for you to participate in that. And I think that's critical. And I think that it helps with with folks doing what you're asking them to do because they understand what's happening. You know, in order for them to participate, they also have to understand. So going back to docere, making sure that folks understand what you're asking them to do and what you're giving them, why you're giving it to them. That power, that empowerment that folks get and the sense of responsibility is really important. So yes, you will be working. If you come and see any of us, you're going to be working.
Yes. Did anybody else want to add to that? All right. So another question that was asked, let's see. Insurance. Do you take insurance? So I'll answer part of it. On a large part, insurance doesn't take us. In most states, insurance doesn't take us. There are still a lot of states that are not licensed, like naturopathic licenses are not accepted or acknowledged. So in those states, especially naturopathic medicine, insurance does not consider or even look at naturopathic doctors. In those areas where insurance does pay naturopathic doctors, it really is, excuse me, on an individual doctor by doctor basis, because not everyone wants to be confined to the constraints of insurance companies, and they don't want to be held, they don't want their money to be held up by insurance companies. Does anyone else want to answer that?
Yeah, I've been answering that one for years, and I agree with you 100% about, naturopathic medicine is not uniformly accepted by insurance companies. So for instance, here in California, they will pay for any and all lab tests that are on their roster of eligible lab tests, but they will not pay us for our expertise. So they don't pay for consultations and other services. But if we ordered labs, they'll pay for it. Crazy, huh? I know, right? Like, this is just not a rational system. We know that.
I'll throw out there as well for anyone who may be listening in from above the 49th parallel in Canada. That's where I started my practice, where I was educated as a naturopathic doctor, but also where I started practicing right after school. And there, where they have I was in Ontario, I'll say, because, I don't know about all the provinces, but, there's a more socialized healthcare, so a baseline healthcare for everyone. It's called OHIP, Ontario Health Insurance Plan, for everyone who, pays taxes and things like that. But for the people who had pretty much, most of the people I saw that worked, definitely worked for an organization, they had naturopathic medical benefits. I think that's kind of in line with the question you're asking about the insurance.
Yeah.
So, that was a really great resource to the citizens of Ontario. And they were able to, I never had to process any insurance payments or anything. They would have to, give that, they would put that through, and they would able to get those services covered. And, there's a whole conversation there about just, using your naturopathic benefits, and how people who do have benefits for naturopathic medicine, they work better, they have, they're better employees and all that sort of stuff. So I definitely hope to see a shift in that way, just to make, our work more accessible to everyone.
Yeah.
I also remind people a lot of times here in the US, the flexible spending plans and the health savings accounts are often renewed if they are part of a corporation somewhere in the September, October timeframe. And so I have to always tell people, look, it's a moral hazard. I don't want to be your financial planner. Like, things cost what they cost. By the same token, if I can give you a look ahead into the cadence of how often I will need to see you, what the lab tests are likely to cost, et cetera, you can plan in the future for whether or not you want to participate, let's say in a health savings account or a flexible spending plan, so that then the next year you have those benefits for paying for naturopathic medical services, paying for eye care, dentistry, et cetera, all the things that are not typically covered standard in health insurance, unless it explicitly includes naturopathic medicine, or you practice in a state like Arizona or Connecticut where there is insurance parity. Insurance parity doesn't exist in most of the states. So, just to help them think about it and then start to push for it. So if they have any way to advocate with their company and HR, human resources, to make sure that benefits are inclusive, because the company's going to be spending money anyway. Why not spend money on something that is this incredibly cost effective? The patient is left stronger, more clear-minded, more energetic, and it doesn't lead to catastrophic bills. Why wouldn't you say yes to that,
So for those of you who are watching, please be sure to ask whatever questions you may have while we're here, and we can answer them, live. Otherwise, we can answer your questions, your questions as we look back at the recording. So make sure you're asking whatever questions you might have. And to piggyback on what you were just saying, Dr. Yates, another question that was asked was, how often can I expect to see a naturopathic doctor? Is it like a conventional doctor where I'm given a prescription and told to do something and come back in 6 months? or is there something else?
For what I've seen for most chronic conditions, it's usually our typical cadence is we have our initial intake visit, right? Our initial consultation, that's about an hour. And then the second visit, that follow-up visit is often more like 45 minutes because I might need to review specific sorts of advanced physiologic lab tests with them. They might be a first time they've ever seen anything like this, so it takes time to explain. And then after that, for us, usually it's half-hour appointments from there, pretty much monthly for the first 3 to 6 months, depending on how complex their health picture is. And then after about that half-year mark, then we often can go to an every 2 months to every 3 months, a quarterly pattern, unless they have something unusual that comes up in the meantime, and they're usually fine there. And then for patients who've really been paying attention and have done their homework, who've walked the walk and who've been cooperative, who've actually, followed the plan, they didn't think I was going to wave a magic wand over them, they participated, we can get to the once every 6 months or so, or even yearly visits, depending on, I'm thinking of very specific people now who are like my A+++ students, whom I just adore and have so much regard and respect for because they've had some hard things. They faced it though, and they're so much better on the other side. So yeah, that for at least my kind of practice for like heart disease, diabetes, arthritis, asthma, GI problems, gastrointestinal problems, because all naturopathic physicians can help people with gastrointestinal problems all day long. That's usually the pacing. At least that's been my case in my practice. You other doctors here may have a different cadence, but for me, that's been the rhythm.
Yeah, I think it's fairly similar. The initial visit is a lot of information. It's information gathering. And I think Dr. Mai, or is it
Yeah, Mai, that's me.
Sorry, Dr. Mai, to your earlier points, because this is very individualized, I think that's something that you mentioned. I will start out by saying that your very first appointment, I'm gathering all the information. So we're going to spend a lot of time with you answering a lot of questions. And sometimes the questions might not seem related, but trust me, I'm asking them for a reason, because what I'm going to make, the recommendation that I'm going to make is going to be specific to you. When I initially started working in the state of Washington, so south and north of Seattle, and they are covered by insurance, we were considered primary care physicians in the state of Washington. So folks could choose me to be their primary care doc, or they could choose me to be a part of their care team. So if I was their primary care, regardless of the role that I played, the approach was the same. So I'm going to gather information. I'm either requesting labs from, if I'm just a part of your team, I'm requesting labs or most recent labs, because I need to look at them in the way that we approach them as naturopathic doctors. And I do all that in person. So if I do any labs on that initial visit, and generally I might be doing some things on that initial visit, especially if they haven't had labs done in over a year. And I would see lots of people that hadn't been to the doctor in a year plus. So I wanted to get an understanding of what their baselines were. And then they would come back in a week when those results were in, and we would go over them. So they had an understanding of, this goes back to docere, and I'm teaching them, and like, this is what this says. You're technically normal. However, you're low normal, and that's probably why you're feeling like crap. So we need to get you, we need to move this number. So at the week mark, we'd be going over any of the labs that I've either received or I've ordered, so that they had an understanding of what's going on with them and the recommendations that I was going to make. At that time, because I've gathered so much information, I have a week generally to sit with that information and sift through it to make very specific recommendations. And then that following visit, when we're going over the labs, we're also going over my treatment recommendations. And depending on what it is, I'm going to give those treatment recommendations a few weeks, maybe 4 to 6 weeks, to see how they respond, unless they have some adverse reaction where they might need to see me sooner or contact me sooner. I'm giving them 4 to 6 weeks to try the things that we've come up with based off of my evaluation of the information that I've received, both from them and any labs. And we have a follow-up in 4 to 6 weeks. If they're still doing okay, we continue on. But there's also that part that Dr. Yates mentioned with just setting those expectations. This is not going to be an overnight thing. That's not how naturopathic medicine works in many cases. In some cases, you do get results quickly. And in other cases, with more chronic diseases, then it's going to take a little bit more time, because we also need to figure out what is going to work specifically for you. So that might shift depending on, what's happening. So initial appointment, a week follow-up, to review labs, go over treatment plan, and then 4 to 6 weeks. And then you'll see me, maybe every 4 weeks, so monthly, like Dr. Yates has mentioned, for a period of time. And I always tell people, my goal is for you to not have to see me. So that is my goal. I want to get you to a point where you don't have to come in and see me every week, every month, but it's going to take us some time to get there. So very similar to what Dr. Yates mentioned as far as the timeline.
Yes, for me, it depends on what you've come to see me for, what we've decided we're going to work on, and also co-management of care. So I really do believe naturopathic medicine is integrative medicine. So if you have, a medical team, a lot of times I'm working with women with fertility, so that, they might be working with a fertility clinic. So some of the regularity of our visits will depend on that. A lot of the women I see are pregnant. So if they're also having OB-GYN or midwife appointments, that might influence, how often you see me and how often we touch base. If you're getting ready for a birth, if you need labor induction support, things like that. But what I will say is that, I have my initial visit. It does tend to be longer. It is all information gathering. Hopefully, if you provided me with any previous, labs and such beforehand, I have time to go over that. And then hopefully we'll do a focused physical exam in that first visit. And then I try to get people in within that first week. Very much like Dr. Safiya said, because you can't expect, I would say don't expect, to get a treatment plan, a fleshed out individualized treatment plan until your second visit. So I always say, prepare for 2 visits at least. In that first visit, might go over some very basic, information about diet and sleep hygiene and things that are really helpful to everyone. But for that individualized plan, that's probably going to be within that first week. And then I tend to see people about every 6 to 8 weeks.
For me, for the patients that I've seen, it depends on the modalities used. And so obviously that depends on what state you're in. So in Arizona, we do a lot.
Can you explain what a modality is?
Modalities. So we as naturopaths we have a lot of tools in our toolbox. So there are a lot of different things that we can use in order to heal you, to help your healing. So acupuncture is one of them for some states. Nutrition and diet counseling is a modality. Some naturopathic doctors use homeopathy. We do physical medicine as well, depending on what state that you're in. So it's just a lot of different areas, and it depends on what doctor you go to and what state you're in.
Thank you.
And so in Arizona, we use a lot of acupuncture. And in that case, we see our patients a lot more often if you're using that. For nutrition counseling, diet counseling, we will do kind of like Dr. Yates said, we see a lot of chronic things, and it took you a while to get there. So it takes us a while to get back. So we'll do 4 to 6 weeks there to get you used to your nutrition plan and things like that. So for us, it kind of just depends on which modality and which route you chose, or that we chose for you.
Do naturopathic doctors perform house calls?
I do. I remember in school, I don't remember which professor and mentor it was, but one of my professors just was talking about how that you should really think about it as the art of the house call, and that the art of the house call has really been lost by a lot of medical providers. And that stuck with me. And then when during naturopathic medical college, I added that component of birth care, doula care, perinatal care. And then there's a lot of home visits that happen as a doula. Then that just kind of compounded it. and then working, community-based care that just compounded it. So I definitely do house calls, and actually practicing here in Chicago, my whole practice is mobile. So so that's what I do. I move around.
I have not. I have colleagues that have done house calls. I have not done that. However, what I did learn from them is that there's a whole an additional layer of information that they're able to gather from like being aware of the environment that a person is living in, that won't make its way into the into the office when they're there. So I think they can be really valuable, and folks respond very well to that because it feels the relational aspect of that is very different than coming into an office. There might be some accessibility needs, and I guess I'm saying this for any new grads or soon to be grads that that may be watching Dr. Williams, future Dr. Williams, and this is something that you want to keep in mind. I think that there is a real art to that and beauty to that has been lost.
There's definitely a level of intimacy and rapport that you that you develop by being in someone's space and really being able to observe them in their environment. And then also there's such an appreciation, especially as a birth worker, but also as a doctor. I often feel blessed by the people that I work with. And I'm often, thank you for, involving me in this part of your journey. Thank you for involving me in this miracle of growing your family and all of that. And also being able to be invited into someone's home, I get that same feeling, that same sort of, it's privileged.
Yeah, because I don't let people in my house. So definitely, it's definitely a privilege to be asked and welcomed in someone's home, especially when you're coming to visit them when they're not feeling their best, because that's the reason why we're coming. Like the reason why we are usually coming to someone's home or we're meeting with people, I should say, is because they're somewhere in a space where their health is not where they want it to be, where they need it to be, and they need some guidance in getting it where they think it should be, or we think it should be. With that being said, did you have something else to say, Dr. Yates?
Yeah, with home visits, I've done them on occasion, including when I would occasionally do some birth-related visits. I had done the midwifery training, so I have deep respect, Dr. Heath, for what you're doing. That's just amazing. I do feel like there's a miracle in the room. And I've done some other visits on, I'd say, rare occasions. I had recently made a decision a few years ago not to, just because of some of the craziness and awful stuff that happens where we're targeted, and I just don't want to take that risk. Particularly with somebody, if it's a first time appointment, I won't do it now. I just wouldn't. But this was for well-established, well-known patients for whom I knew it was safe for me to be there as an African-American woman. So I just wrap it up that way. Yeah.
Thank you.
That's actually a really good point. There is, for the practitioner, there is a whole nother level of preparation that you have to do to ensure that you're safe. It took me a little while to remember to ask people if they had pets, just certain things you don't necessarily think about, so there is a total level of another preparation that you have to do. So that was good that you touched on that, because it's the pros and cons there. You have to weigh it. It's not all peaches and cream, but I do enjoy home visits, but yeah.
So next question is not necessarily something that I heard from someone else, but it's my question to you all. Pet peeves. Being in the space of being a doctor, being in the space of being an African-American doctor, being an African-American female doctor, and being a naturopathic doctor that people are not necessarily accustomed to. What are some of the things, and I'm going to call them pet peeves because I'm not really sure how else to call them. What are some of the things that really make you side-eye people or grinds your gears or makes you ask them to repeat themselves a different way or something like that? Something that you would love for people to know that they may or may not know out of ignorance or out of learning from Dr. Google or whatever it is.
How much time do we have? I'm gonna be quiet for a minute. Let somebody else go.
Please, Dr. Heath, go right ahead.
I'll go with one. I want to echo Dr. Yates though, because I feel like woo, we could probably all give a little speech about that. But I say I'm going to try to break it down and think about something. And maybe this is too small. Maybe you got to be like, that's really small. But I'm going to say dosage. You mentioned Dr. Google. People oftentimes think that they can, replace, our expertise and what we do and our knowledge with, Google. And sometimes they do come up with stuff. And I think, well, yeah, that maybe would have been a part of something that I would also, recommend or something like that. But dosage is something that can make something inert or can make something poisonous, and depending on where you are. Another thing, see, now I am going up. And I'm like, it depends. Your medical history too. When people, they want to say, oh, try this. And it's like, you don't know what she's on, what her history is, what's her heart like, has she had it? We do a lot of detective work, and you cannot replace that with, I don't know. It was small but big. I did.
Yes. The first thing that came to mind before cannabis was legalized, I'd say I'm an naturopathic doctor. Oh, so no, you cannot. No, that's not what I do. Nope.
So yeah, as soon as somebody you do herbal medicine, you prescribe herb.
Yes, exactly. It's so having to. Did you hear that other word after naturopathic? I said either naturopathic physician or naturopathic. So I used to get really irritated by that. And then it became a little bit more, just, an eye roll. The expectation that I am going to just say, don't take your medications. That is a pet peeve of mine. I don't know. I'm not quite sure where that comes from. But sometimes that's the first thing people will say. Well, I'm coming to see you because I don't want to take them or I want to get off of them. And then, so that it may not be safe, and not thinking about the safety of it. Dr. Mike just said, I don't know what your heart is. I can't say stop taking that today. I don't know what your heart is going to do if you stop taking that blood pressure medication. I'm not going to tell you that. You just may have to stay on. You just may have to stay on that for the rest of your life, like that. But there is this assumption that I'm going to say, oh yeah, don't throw all of that in the trash and drink this tincture. As an acupuncturist, I just need to throw this in there. You're talking about pet peeves. I'm a practitioner, and my worlds mesh all the time. I will prepare a Chinese herbal formula for folks, and they will say, "Oh yeah, my partner, my sister, my girlfriend from down the street has the same thing, so I'm just gonna give her some of mine." Like, no, again. I don't know what her heart's gonna do. The fact that this is actually individualized medicine. So acupuncture is individualized, naturopathic medicine is individualized. So the formula that I gave for you, the treatment plan that I have created in conjunction with you is for you. It is for you. It's not for your husband, your partner, your homie down the street. It is for you. So stop doing that. I know you have the best of intentions, but it might not be helpful. So tell them to come see me or one of my wonderful colleagues here to get their own individualized care plan. Those are my top three, I guess.
Dr. Williams.
My top one is the expectation of all these miracles that I'm supposed to work after you've tried. I can't tell you how many patients come in and I've tried absolutely everything. And I mean, they're coming to you with the last bit of vital force left, expecting you to hand something over to them to make them better in like a few days. And it just doesn't work like that. And I hate having to explain that, because people do come to you with hope. And don't get me wrong, there are a lot of people that get a lot better off from naturopathic medicine. But I do wish that there was a light bulb or something that went off maybe a little earlier, or maybe the information that people had a little bit earlier, or access that they could get to us a little bit earlier in their health. And then so that they don't have to wait so long and wait to the end. Because at the end of the day, even the herbs, which are absolutely wonderful, and even if we use acupuncture, which is absolutely wonderful, it's not an over the night fix. And so I think that's my top pet peeve, is just waiting to that very, very last moment to go see a naturopathic physician.
And I think it's interesting that since you are a student and you are already seeing this, and the fact that you've seen it as many times as you've seen it, yes, is saying quite a bit.
Yes. Very much so.
Dr. Yates, give it to us.
Yes, I can't wait to hear this.
You know, I'm champing at the bit, right?
I know it.
So one of my pet peeves that you guys haven't mentioned yet, but I know you women have run into at least once, is where people make an assumption about whether or not you believe in science, your intellectual capacity to grasp complexity, your intention to actually help them, as opposed to just take money out of their pocket, even though they've questioned no one else in this way, keep in mind. And, you know, the grilling that goes on about background. Like in my case, I've got a hybrid background. I am licensed as a naturopathic physician. I practice in different states like Oregon, Hawaii, and here in California. And I'm also an electrical engineer from MIT. And people act like I'm crazy. And I'm like, no, I'm not crazy. I have a profound love of science and technology. I always will. But you know what? There's a ton of science and there is some technology in the use of naturopathic medicine. This is the most rational approach to healing I've ever come across. So no, I'm not crazy. And why didn't we meet sooner? Because you could have probably enjoyed less suffering a lot sooner too. No one has told you how fundamental nutrition is, but I'll bet if you have a car, you know to not feed it crappy oil. You know the motor weight of oil, right? So if you're in a hot, dry environment, if you're in the deserts in California or in Arizona, you know there's a certain motor weight. If you don't put the right motor weight oil in that engine, it's going to seize up. If you go to a cold place up into the Sierras, if you're in Colorado, Utah, you know, mountains, same idea, right? But a lot of folks have no grasp that what they eat affects their health in a profound way. If your spiritual diet is one that's poisonous, if you use social media and it's all about negativity and lies and untruths, if it's all about misinformation, disinformation, like the fact that we even call that stream of stuff that comes at us a feed is profound. If you're accepting that and not questioning it or choosing to not participate in stuff that just doesn't help you in ways that serves you, you know, you just got to be questioning. So the things I've heard people say over the years are, well, why are you doing this? As if I'd somehow completely lost my mind. Other things I've heard people say is they'll assume I'm some other kind of health professional and I'll make a really specific comment about something, like when I'm out in the public. Only once has someone, and I've been in practice for over 26 years now, only once has someone said, are you a doctor? They've almost always said, are you a fill in the blank, but not doctor. And this is something that is unique to Black doctors in this country. We're always being devalued and put down. And that's not to throw shade on any other health professionals. I love all health professionals. I have no problems with what people do, but I want my due. And it's just interesting because you're doing this because you actually care about others. You're certainly not doing it to get rich. You're not doing it to be famous. And I just think there's a certain level of respect that's not given up front. And it's a problem. I know that Black teachers run into this, Black lawyers, Black fill in the blank professionals in general. So I think for me, that's one of the pet peeves. And I just be mindful of time. But yeah, that's a pet peeve.
Give me one more, because I'm interested in hearing one good one.
Another pet peeve is that people assume that I will be rigid and never prescribe medicine. So for instance, I have a number of patients who are on hypothyroid compounded medications, and they are overjoyed because I'm the only doctor they've ever met who will prescribe compounded medications. And I've used about compounded medicines for any number of things, you know, really funky toenails, thyroid issues, et cetera. And you have to meet people where they are, people who have sensitivities, young children who have difficulties with certain kinds of mobility of their mouth. Their neuromuscular and orofacial connections aren't so good. And so they need to have medicines delivered in a different way. And like people are like, how did you know about that? Like it's magic. I'm like, because I was trained and I actually paid attention. That's how I know about it. Like, why don't you ask the people you've been seeing and paying for years and decades why the hell they didn't do a better job for you? That's actually the question. It's the same one as the insurance question. Why don't you accept it as if I'm somehow the one who's flawed? It's a flawed system. As we've seen on display, writ large with steroids times 1,000 in the last few weeks. So I just would implore everybody, push back. Part of how I got here was back in the day when I was an electrical engineer was I got sick with allergies. And I didn't know any better in my early 20s. I was so full of energy and pep. I was not a part of this world, didn't know anything about it. And I called, in that case, it was, I believe, Blue Cross Blue Shield Insurance in my insurance company. And I was working electrical engineer, Silicon Valley. And I said, why don't you cover naturopathic medicine? I was getting so sick seeing a convention allergist. I saw this naturopathic physician for 3 times. You won't pay for his visit. I don't understand why. He's the one that got me better. Shouldn't we pay for results? Like, we're paying money and we're paying the people who had me get sicker. The dude who helped is getting nothing. I don't understand that. And they didn't have a good answer for me. I talked to managers, and long story short, they did indeed pay. And that was at a time when there was no licensing to mandate it. I just insisted that the money that was going out go to the people who got the job done. And I just think more people need to push like that. We'll get there. But yeah, those are some pet peeves.
All right, thank you. One of mine, one of you touched on is people will question what's in that. If if we give a supplement or we give an herb, what's in that? You've never asked that about medication you were taking, you were given. Not Yeah, hypertension medications, diabetes medications. You know what metformin is, but do you really? Do you know all of the things that go into making metformin? Did you know that one a day vitamin that you bought at the corner drugstore was covered in shellac? Did you look at the ingredients? And you're asking me, and I'm giving you the best that I have available, that because I know that this works. Did you really ask that to everyone else, or are you just coming to me because the guy at GNC told you that you should take something or other? He's been working at GNC for all of 3 months, so he must know what he's talking about. That's one of mine.
Yeah, the power of marketing. Yeah.
Yeah. Anybody else have a thing? I can see a bunch of fuming, a bunch of holding back. Anyone want to share?
It's all, you know, it's all of those things that the questioning though. And this was in reference to acupuncture. The question was, are you all educated? I said, well, and I just rattle off the degrees that I have. I'm like, yeah. So, I mean, and it was the most insulting thing I had ever been asked. And I don't think that the person meant any harm, but it like that was literally the question: are you all educated? And I'm like, highly. I've been in school the majority of my life, you know, and so my petty, came out in that moment, and just the rattling off, of the degrees. But it's and it's not that we're above being questioned, being asked questions or anything like that, but it's just this assumption of a lack of intelligence, or an assumption that this was a plan B career because plan A didn't work out. And it's like, no, this was a conscious, active choice. Because why would I choose this? Like why would this be my plan B? If just because our profession faces, there are quite a few challenges that come along. This is a wonderfully effective approach to health and wellness. But there are some challenges that come along with it. And we accept that, we go into this profession knowing that because we firmly believe in what it is that we're doing. And we either have personal experience firsthand, or we have observed the experience of people that we know and love and how they have recovered, how they feel better, they have a better quality of life because they're using natural therapies. That is what drove many of us into this. That's what drove me into this. That is what diverted me from a career in conventional medicine to naturopathic medicine and acupuncture. So it is a conscious decision to do something that I personally feel is better in some respects for some conditions.
Yeah, we are medically trained and naturopathically focused. I remember hearing that many years ago, and I thought, oh, that's another good, portion of an elevator speech. I think that, I guess one of my pet peeves is that we get so much pushback to get licensure in all of our states and all of our provinces in North America. And then that in turn makes it hard. There's certain places, Chicago really being one of them, where the awareness, the public awareness of naturopathic medicine is really not where it should be. People might think you got crystals and it's woo woo and it's not evidence based, and or they think it's a magic bullet. And especially having practiced in a place where most of the people I saw were like, yeah, my mom took me to a naturopath when I was young, and I'm just continuing to do this, and then coming here and it's like, okay, what is that, or what, and so anyway, I that's one of my big pet peeves, is just how resistant states are to really license naturopathic medicine so that it can be accessible to everyone. We treat all the chronic conditions and some of the acute conditions as well. So thinking about a big pet peeve, that it's very disheartening. So it's a sad pet peeve.
So one thing I want to add to those things, and then Dr. Williams, I'll give you the floor, is that it's not that we're asking people not to question, because we want you to be a part of your own healthcare. We want you to have questions. We want to have dialogue with you. That's the only way that we'll understand what's going on. That's the only way that you'll grow, is for your questions to be answered. But when you get to the point where you are discrediting us before anything else, or you're questioning us more than the people who you've gone to for years and have been harmed by or have not improved by, then it becomes more of a problem. Dr. Williams?
And I was just going to say, to piggyback off that, part of that discrediting is assuming that because we have all this plethora of knowledge that you can just call and receive free care and free consultations here and there. And it's like, you would not call your traditional MD and all hours of the night or any time of the day and say, hey, should I take this? Should I take that? How about if I eat this? And you have to schedule consultations. And there are some doctors who I have shadowed in the past who now have certain payment plans that they've set up so that certain patients can call them. And that is completely fine. But it's almost like this automatic assumption that we're not worth the knowledge and the medical training that we have received. And at the end of the day, this is our livelihood. We do it because we're passionate about it, not for the money, but you have to pay for it in some capacity. So I think that's another one of my pet peeves.
Yeah, to tag on that, I've been surprised. I've had it happen a few times. Thankfully, it has not been my typical experience, but there's a few people I can think of over the years who, after telling me about their fabulous vacations and their multiple homes, would then try their very best to get some kind of fee reduction by the same token, I've also seen people fresh out of homeless shelters who were proud that they could pay for care. So, I think people show you who they are at every turn. And I finally have learned to listen to my mother and all the other people who said, when someone shows you who they are, believe them. So some people have more money, some people have less. I've been able to work out usually payment plans with folks, but the people who come with ill intent or trying to basically steal, commit that kind of theft, it just shows me the lack of integrity they have. And so I already know that their treatment plan might be at risk because of that lack of integrity. It's them, not me, or any of the other healthcare people they've seen. So when they come, and if they've seen 10 doctors, 12 doctors, I know one of two things is true. Either they've ignored them all, or no one really listened and dug in there. Because that's pretty extraordinary. And so far, that's been the case. But yeah.
All right, so I have one last question for you guys, but before I ask, for those of you who are watching, first of all, thank you for watching. Make sure that you are sharing this information, and if you have questions, even after we log off, make sure you type those questions in so that we can answer them and make sure that your questions about naturopathic medicine are answered. My last question to you guys are, who should see a naturopathic doctor?
Everybody.
Everybody, if you're walking, living, breathing, everybody should see. It should be your just standard, I just want to be healthy, standard health across the board. Don't wait till the last minute. We don't wait until our teeth falling out to go see a dentist. And it's the same thought process. You need to be healthy so you can be there for your children and be there for your passions and your careers and things like that. Don't wait until you're just the last bit of sick to come to us. Everybody needs an ND.
Of course, everybody needs to come, like we've mentioned. This is preventative medicine in large part. You don't have to wait till something is wrong with you. You could just want to optimize your life. You could want to augment your your intelligence and support your children, be a better parent, be a better grandparent. For all my minimalists out there, this is, and all my environmentalists out there, naturopathic medicine is holistic care. So not just the person, but this is global care. This is environmental care. So if you are minded in that way, that we taking care of the environment, we're taking care of the animals, we're taking care of ourselves, all of that, each one teach one, global care, optimize your health, and start early from from conception, and raise your kids naturopathically. I'm raising my kids naturopathically so that hopefully in the future they'll have a lot of tools to take care of themselves and their community.
Excellent. Dr. Yates, were you about to say something?
Yeah, this medicine is for everyone. We welcome people with open arms. And for those who are particularly interested in being well and who are willing to put in the effort, and often it's pretty simple stuff. It doesn't have to be complicated, hard, or even expensive. We just need you to consistently show up on behalf of yourself, but everyone is welcome.
Absolutely. I love that. Consistently show up on behalf of yourself. Somebody write that down for me, because I need to remember that later. All right, so we are about to close out. I do want you all to tell everyone where they can connect with you. So let's start with Dr. Williams.
Yes, so you can connect with me. I'm mostly on Instagram and Facebook. I am getting into a little bit other things on social media, but my Instagram handle is at love.mariek. And you can reach me there. I'm always sharing all of things community medicine. So just join me there.
Is that Mariek?
Yes, love.mariek.
All right. Who's next?
I'm unmuted. I'll go next. I can be found on social media. I'm on Instagram, Dr_Safiya. So Dr_Safiya on Instagram. On Facebook, I am Dr. Sofia Mccarter, SafiyaMccarter. on Facebook. So those are the only two social media things that I can handle right now. I just can't. And I am in practice, like I mentioned, in Silver Spring, Maryland, at a clinic called Pulse, like feeling your pulse, Pulse Community Care, and that's at 912 Fair Avenue, Suite 105.
All right.
Hi again. You can find me at my website, www.myheathnd.wordpress.com. You can find me on Facebook at Dr. My Heath ND, birth doula, childbirth educator. I'm on Instagram, Dr. My ND. I'm on Twitter and LinkedIn as well. And I have a mobile practice here in Chicago, Illinois, but certainly reach out to me from anywhere in the world. There's remote services, virtual services, especially for labor and delivery prep, labor and delivery advocacy, birth planning prep, and things like that.
Dr. Yates?
Hi, I can be found on LinkedIn at Dr. Beverly Yates, here on Facebook at Dr. Beverly Yates, and Beverly is spelled L-Y, and Yates is spelled Y-A-T-E-S, because both could be spelled different ways. And on Instagram, same thing, at DrBeverlyYates.
All right, and I can be found on Facebook, Instagram, Twitter at Dr. Turshá, DrTursha, and my website is drturshá.com, DrTursha. Doctors, thank you so much for joining me on this live stream so that we could basically share our love and our passion with the world. And thank you all that joined us. Thank you all for the comments. Thank you all for the questions. And again, make sure that you share this video, and whatever questions you might have, please post them in the chat, in the comments, and we'll be more than happy to answer those for you. We'll see you next time. Take care.
Thank you.
Thank you.